Hello, friends and colleagues. I'm Dr. Henry Rosenberg, who you may know through my work in helping patients and professionals learn how to diagnose and manage malignant hyperthermia, and through my time as the leader of the Malignant Hyperthermia Association of the United States, MHAUS, and through my writings. I retired from my role as clinical anesthesiologist not too long ago, but have maintained my active interest and involvement in all things related to the malignant hyperthermia syndrome and related disorders. Accompanied by a number of devoted colleagues, we keep abreast of the developments of importance to patients, families, professionals, and others interested in the problem of MH. The good news is that thanks to years of education and training, MH is usually detected early and promptly in the operating room, and with the help of dantrolene and other treatments, the outcome of MH episodes is almost often very good. However, without preparation and dantrolene, some still have a poor outcome. This does not mean that the work in preventing and managing malignant hyperthermia and related disorders is complete. Far from it. Since MH is an inherited disorder, work on the genetic basis of MH has been proceeding in Europe, in the United States, New Zealand, Canada, Australia, and several other countries. The practical significance of this work has resulted in having genetic studies rather than the muscle biopsy contracture test used for many years to diagnose those at risk or those who may have sustained an MH episode. Genetic testing is based on a blood sample, saliva, or cheek swab. There are many commercial genetic testing companies that are capable of determining whether the patient has the genetic changes that predict the likelihood of a patient being at risk for the syndrome. However, the test is not yet complete to rule out susceptibility to the syndrome. That is a negative test. Furthermore, the genetic test is not nearly as expensive as the contracture test, and of course, does not require an operative procedure. The contracture test is still useful to help rule out susceptibility to MH in certain cases. For example, in European countries, genetic testing is used first prior to muscle biopsy contracture testing, where there is a suspicion of malignant hyperthermia. However, centers that have the capability to perform the contracture test in the United States have closed, leaving only 2 such centers for the public and 1 for the military. Although our hotline consultants and experts of Malignant Hyperthermia Association often recommend the muscle biopsy contracture test, most people cannot follow the advice because of the need to travel to the center and the cost of the test, which is often not covered by health insurance. Information from genetic testing is often very useful, but many physicians are not terribly familiar with the interpretation of the test. That education is often provided to those physicians by such individuals as anesthesiologists, surgeons, neurologists, genetic counselors, and geneticists. More on this issue will be presented by organizations such as MHAUS and the European Malignant Hyperthermia Group, among others. There are many other benefits that are following from genetic studies of MH and similar disorders, which I will discuss and which will be published in the near future. The progress in helping patients and professionals through genetic studies is impressive and very exciting and growing steadily. As MH is an inherited disorder, we are beginning to work with geneticists, genetic counselors, and others to get a better comprehension of the ways to diagnose and manage the symptoms and signs of malignant hyperthermia. Thank you all for the support of MHAUS, for the support of the European MH Group and other societies such as the RYR1 Foundation involved in the many aspects of this disorder. If you have any questions or wish to comment, you may reach me by email at henryrosenbergmd@gmail.com. Other consultants may be reached by seeking them out through the mhaus.org website. Thank you very much. I look forward to speaking with you again and hearing from you in different occasions.